My name is Hyewon. I'm the chair of the Oral Health Work Group of the World Federation Public Health Association. I'm a pediatric dentist. So as a pediatric dentist, we do see patients under general anesthesia if they have so many cavities and so young. So prevention is really important to save uh, um, the financial burden, but also emotional burden from the families to have a healthy mouth and healthy smile. So I really wanted to start early prevention, starting from actually pregnant women. So that's how I got interested in pregnant population. So I worked on national guideline, U.S. national guideline for pregnant women's oral health about 12 years ago. And that was the beginning of my public health career. So this year will be 13th year. I joined 2012 as intern and then vice chair and then now chair. So I really grew up with Public Health Association, the federation, through my career path. Our work group is quite unique in the sense that we really collaborate with other work groups a lot. So we've been collaborate with the tobacco control work group, the women's health, the women, children and adolescent work group, and other work groups to really move our common agenda forward, which is health. So we've been working on a couple of policy resolution that has passed and endorsed by the General Council of World Federation Public Health Association. And we generated a series of publication last days and this year, highlighting oral health in the field of primary healthcare and beyond the healthcare system, such as a school-based oral health models and really highlight like promoting health, preventing diseases, and raise up the voices of people and health professionals. So we really want to follow that core values of WFPHA. So we would like to highlight the health theme and the prevention and promotion theme throughout our work. For example, in dentistry, it's really focused on treatment plan and curing the diseases rather than preventing some of the common oral diseases, because the system kind of guides our colleague, our providers to go that way. It's incentivized when we do more drill and fill. So we have about 30 members from like 17 different countries now. So we learn from each other what are the innovative models and workforce models as well to really highlight oral health, not just the treatment of oral diseases. One of our highlight or our major achievement is the Global Maternal Child Oral Health Initiative that we launched in 2023 through the World Congress on Public Health. So it took about 2 years for us to collaborate with the Women's, Children, and Adolescent Health Group and other colleagues from different countries, both low income, middle income, and high income countries. And we clearly stated that based on the evidence and literature review, oral health should be the integral part of prenatal and postnatal care. And this two-page policy went through all the way to General Council of our federation. And we launched it with about 50 national and international entities who endorsed our initiative, meaning in the future, we are going to collaborate with this international organization and professional work groups or associations to integrate oral health into antenatal and postnatal care. We also have a Ministry of Health of some countries. We have a think tank and research entities who signed up for this endorsement. So we believe this will really expand our future action plan to collaborate with them and highlight oral health in maternal and child healthcare system. One of the example I just shared with the maternal child health initiative, but we also recently performed a global oral health survey. We investigated and assessed what's the challenges that we are facing now as a primary oral health workforce, including dentist and non-dentist dental workforce, such as dental nurses, dental hygienists, and so on. So we just presented on our finding at the International Federation of Dental Hygiene Association conference, and it was very well received that we really need to expand our definition of primary oral health workforce, and essential oral health care is not just drill and fill by dentist, but we include a lot more workforce, including nurses and doctors and community health promoters and others, mothers and teachers, to really promote health inside health sector and also outside health sector. The other work that we've been doing, we really highlight the school-based oral health care model too. We published editorial at the Journal of School Health this year that we really need to focus on the policy level, workforce level, and the program level to integrate oral health in the school setting, not just treat them or giving them oral health education, but also think carefully what we give out in school-based setting like vending machine and the cafeteria menu. How can we create a healthier environment for these school-age children? And expanding on that, now we are finalizing our casebook series, school-based oral health program. We interviewed 8 or 9 school oral health models in different countries with the structural interviews. And we are going to publish a casebook on school-based oral health models, probably around in September. So that is our major achievement. Hmm. Well, I think it really depends how we define community. Hmm. We can reach out the health professional, public health professional community, which we are doing. We can also reach out to non-health or non-dental community, which we are doing that. What I was wondering when I saw the question from you, are we really raising voice of patients, the general public, that community? Because what we are usually doing is like 3,000 feet level of policy work, the resolution, recommendations, and that level of collaboration. But how can we measure our work's impact, tickling down to the real community where people live and work? So I thought that was a brilliant question. How do we do that? I think the beginning or the starting point, I really want to include more junior and youth group into our work group as well. Currently we have 3 interns. One of our interns promoted as a vice chair actually. So it's really refreshing for me to communicate with the younger people. They are professionals, but they are in the beginning of their career path. But I'm surprised how open and different perspective they are bringing into our work group discussion, which is a new blood. It's very, very refreshing. So knowing that we are planning to collaborate with some international entity and highlighting oral health during the UN General Assembly meeting in September in New York. And we are quite exciting because we proposed the idea, let's not have a classic, standard symposium, like, those the senior people from academia share what they know about. But what if we listen and give that platform and podium to a younger generation, like college students, even high schoolers, or the ones who just graduate dental school, and listen from them what they think the current situation is and what could be innovative solutions. There are so many things we may not know that we don't know, our blind spot, but having those young people, youth group, I think it really vitalize our work group dynamics. So that's one population. The other population I really want to highlight, because maybe that's my expertise, I really want to highlight voices from caretakers. Could be mothers, fathers, or daughters. If there is a old lady who have mental illnesses, then the children can be caretakers. These are kind of hidden heroes that we may not necessarily consider them as a public health professionals, but they are the ones who decide how to cook, what to feed to their family members and friends, and what kind of a lifestyle they are promoting within their community. So I think community members, especially caretakers, they are a crucial element in public health workforce. So rather than considering them as a mere beneficiary of whatever we produce, the guideline or the clinical services, but I think it's really a time to bring them in as a colleagues and members, as a core workforce to move our public health agenda forward, not just oral health, but other areas as well. Mm. So I love this public health association because it's not a dental organization. So we are quite siloed in many different ways, historically too, dental school, medical school, and so on. But because we are worker within federation, we can actually interacting with other worker members and learn from them and also teach them about the importance of oral health. So one of the key activity that we are aiming for this year and next year, we are teaming up with the NCD work group. We are planning to have a series of podcasts, a shorter version of webinar, more towards the general public, how oral health and non-communicable disease are linked, and what kind of clinical approach will benefit the patients and general publics. So we are in the stage of developing our concept notes. And once we have that finalized, we are going to invite different experts from both oral health side and the NCD side. So that'll be like year and a half long project with NCD groups. So this kind of collaboration is very, very valuable. Maybe it'll be really hard if I am representing a whole dental association, but because we are under umbrella of the same organization, the WFPHA, I think this kind of nurturing dynamic and environment is really plus for us to integrate oral health into general health and well-being.